Hello, I'm Dr. Marresa Snyder, and today we're going to dive into something very important for anyone managing diabetes: vitamins. You may not realize it, but if you have diabetes, your body is silently losing some crucial nutrients that it desperately needs. In fact, studies have shown that over 60% of diabetics are deficient in at least one of these vitamins. But why is this the case? High blood sugar levels, medications like metformin, and chronic inflammation all work together to quickly deplete these essential vitamins. Without these vitamins, your health can slowly deteriorate, affecting your nerves, heart, energy levels, and even your mood. But the good news is, replenishing these nutrients can make a significant difference. Today, we'll be talking about the top 4 vitamins that every diabetic must take. These are backed by scientific research, and I'll provide you with practical tips on how to incorporate them into your diet, as well as supplement options that actually work. Let's begin with the first one, vitamin B1. Section 1, Vitamin B1, thiamine, the unsung hero for energy. Vitamin B1, also known as thiamine, is one of the most essential nutrients for diabetics, but it often goes unnoticed. Thiamine is vital for helping your body convert glucose into energy, but unfortunately, diabetics tend to lose more of this vitamin through their urine due to high blood sugar levels. Essentially, the kidneys flush out more thiamine as your blood glucose rises. On top of that, insulin resistance and inflammation, common in diabetes, prevent the body from properly absorbing thiamine into the cells, making deficiency even more likely. When thiamine levels drop, the effects can be far-reaching. While the signs may not be immediately obvious, they can gradually interfere with your health in serious ways. Thiamine plays an important role in nerve function, heart health, metabolism, and even mental clarity. Without sufficient thiamine, you may experience symptoms such as fatigue, anxiety, depression, and cognitive fog. Your metabolism can slow down, making it harder to maintain a healthy weight, and your nerve health can deteriorate, worsening neuropathy, nerve damage. Additionally, thiamine deficiency can also impact your kidneys and eyes. It accelerates kidney damage by stressing the glomeruli, the filtering units in your kidneys, and in the eyes, it increases oxidative stress, contributing to diabetic retinopathy. When it comes to your heart, thiamine is crucial for producing ATP, the energy molecule that powers your heart muscle. Without adequate thiamine, the heart's ability to function properly is compromised, increasing the risk of heart failure and hypertension. For diabetics, thiamine deficiency is a real issue. Studies show that between 17% to 75% of diabetics suffer from low thiamine levels. And in some populations, the deficiency rate can reach as high as 76%. These are not just numbers. They indicate a significant metabolic loss that needs to be addressed. Thiamine-rich foods. Fortunately, there are ways to replenish your thiamine levels. Here are some excellent food sources. Pork chops, just 3 ounces, 85 grams, provide 63% of your daily thiamine needs. Sunflower seeds, a 1/4 cup, 35 grams, offers 47%. Black beans, 1 cup cooked gives 27% of your daily thiamine. Trout, 3 ounces deliver around 28%. Mussels, 3 ounces can provide about 30%. For those looking to enjoy gourmet meals, consider these thiamine-packed dishes. French-style garlic butter mussels, a bowl, 200 grams, can give you up to 70% of your daily thiamine. Spanish pork tenderloin with paprika and sherry, 150 grams can provide 75% of your daily thiamine. Trout almondine with sunflower seed crust, 140 grams offers 55–60% of thiamine. Supplementation. If food alone isn't enough, thiamine supplements are a great option. The best forms of thiamine are benfotiamine and L-thiamine. Benfotiamine is fat-soluble, which makes it easier to absorb and more stable, while allithiamine derived from garlic is highly bioavailable and penetrates cells deeply. A typical dose of benfotiamine is 150-300 milligrams per day, and for allithiamine, 50-100 milligrams is recommended. Section 2, Vitamin B6, pyridoxine, the essential vitamin for nerve and hormone health. Vitamin B6, also known as pyridoxine, plays a critical role in several metabolic processes in your body. When you're diabetic, this vitamin becomes even more essential because it helps regulate glucose metabolism, supports brain health, and keeps your nerves in good condition. However, for many diabetics, vitamin B6 deficiency is a hidden issue that often goes unnoticed. Why is vitamin B6 important for diabetics? High blood sugar levels, kidney stress from diabetes, and medications like metformin all contribute to the depletion of vitamin B6. The chronic inflammation that occurs in diabetes accelerates its breakdown, and the kidneys often excrete more B6 through urine. So even if you are consuming foods rich in vitamin B6, the body may not be able to absorb or retain it properly, which increases the likelihood of deficiency. When B6 levels drop, you may notice subtle signs, such as mood swings, irritability, and increased anxiety. That's because B6 is essential for synthesizing neurotransmitters like serotonin, dopamine, and GABA, which regulate your mood and help you feel calm. Without enough B6, these neurotransmitters can't function optimally, leading to anxiety, depression, and irritability. Additionally, B6 plays a role in protein metabolism, and a deficiency can make it harder for your body to manage glucose levels and lose weight. Other consequences of B6 deficiency include neuropathy, nerve damage. B6 is crucial for nerve health, and a lack of it can worsen diabetic neuropathy, causing tingling, numbness, or burning sensations in the hands and feet. Hormonal imbalance. B6 helps regulate hormone levels, including sex hormones like progesterone and estrogen. Deficiency can affect fertility, libido, and overall hormonal balance. Heart health. Vitamin B6 plays a role in maintaining healthy arteries and lowering homocysteine levels, which is important for cardiovascular health. Without B6, you may face an increased risk of stroke, heart attack, and vascular issues. Natural sources of vitamin B6. To maintain optimal levels of B6, you should include these food sources in your diet. Beef liver, just 3 ounces, 85 grams, provides around 70% of your daily B6 needs. Turkey breast, 3 ounces of cooked turkey, provides 50% of your daily B6. Sunflower seeds, a quarter cup, 35 grams, offers 30%. Chickpeas, 1 cup cooked gives 55%. Wild-caught salmon, 3 ounces, offers 45% of your daily B6. Gourmet meal ideas. If you're looking for delicious meals packed with vitamin B6, try these. French pâté made with beef liver. A 100-gram serving delivers 80-90% of your daily B6. Moroccan spiced turkey with chickpeas. 1.5 cups of this dish offers 65-75% of B6. Nordic-style salmon fillet with sunflower seed crust. A 150-gram serving provides 60-70% of your daily B6. Supplementation. If you need to supplement, the 2 main forms of vitamin B6 are pyridoxal 5-phosphate, P5P, and pyridoxine, HCl. P5P is the active form of vitamin B6 and doesn't need to be converted by the body, making it easier for those with metabolic issues to absorb. A typical dose of P5P is 25 to 50 milligrams daily, while pyridoxine HCl is often used at 50-100 milligrams, though it must be converted by the liver first. Section 3. Vitamin B9, folate, the DNA repair vitamins. Vitamin B9, also known as folate, is another crucial vitamin for diabetics. Folate plays a key role in several biological processes, including DNA synthesis, red blood cell formation, and cellular repair. It's also involved in the methylation process, which is essential for regulating gene expression and managing inflammation. But for diabetics, maintaining optimal levels of folate can be a challenge due to several factors. Why is folate important for diabetics? Chronic inflammation, high blood sugar levels, and common diabetes medications, such as metformin, can all contribute to a depletion of folate. Metformin, in particular, has been shown to significantly reduce serum folate levels in just a few months of use. High blood sugar also damages the intestinal lining, which impairs nutrient absorption, including folate. Additionally, kidney dysfunction, which is common in diabetes, can lead to folate losses in urine and reduce its conversion into its active form inside the cells. As folate levels drop, the signs can overlap with diabetic complications, making it challenging to spot a deficiency early on. Some of the symptoms include fatigue and low energy. Folate is essential for cellular energy production, and when levels are low, your body can feel sluggish. Mood disturbances. Folate is involved in the production of serotonin and dopamine, the key chemicals responsible for mood regulation. Deficiency can lead to anxiety, depression, and irritability. Cognitive fog. Folate is crucial for maintaining healthy brain function. Without enough, mental clarity and memory may suffer. Neuropathy. Low folate levels can worsen diabetic neuropathy, leading to increased nerve pain and sensitivity. Weight issues. Folate helps regulate metabolism and insulin sensitivity, so a deficiency can make it harder to manage weight. Furthermore, folate plays a key role in vascular health. It helps lower homocysteine levels, which, if elevated, can damage blood vessels and increase the risk of cardiovascular disease. In diabetics, this raises the risk of atherosclerosis, heart disease, and other complications related to poor vascular health. Folate-rich foods. Here are some of the best food sources of folate. Beef liver, just 3 ounces, 85 grams, provides around 54% of your daily folate needs. Lentils, 1 cup cooked offers 90% of your daily needs. Asparagus, 1 cup cooked provides 65% of the recommended daily intake. Spinach, 1 cup cooked delivers 66% of your daily folate. Avocados, 1 whole medium avocado gives you about 22%. Gourmet meal ideas. For those looking to enjoy luxury meals that are rich in folate, here are a few recipes to try. French duck liver pâté with asparagus foam. A 100-gram serving delivers 75% of your daily folate needs. Mediterranean lentil and spinach stew with garlic and lemon. This dish provides 110% of your daily folate. California avocado and poached egg salad with microgreens and truffle oil. 1 large serving offers around 35–40% of your daily folate. Supplementation. If you're looking for a supplement, the best form of folate is methylfolate, 5-THF, the active version your cells can immediately use. A typical dose is 400–800 micrograms daily. For those with an MT8FR gene mutation, which impairs folate metabolism, methylfolate is the preferred option. Another good option is folinic acid, which is easily absorbed and quickly converts into methylfolate. Avoid synthetic folic acid unless you know your genetics, as it's less efficient and may cause issues for some individuals. Section 4. Vitamin B12, cobalamin, the nerve and energy vitalizer. Vitamin B12, also known as cobalamin, is one of the most essential vitamins in the body. It plays a crucial role in DNA synthesis, nerve repair, red blood cell production, and brain chemistry. However, B12 deficiency is surprisingly common among diabetics, particularly those who take medications like metformin. In fact, studies show that up to 30–40% of diabetics, especially those on metformin, have B12 deficiency, and many others are borderline low. Why is vitamin B12 important for diabetics? Metformin, the most prescribed medication for diabetes, can interfere with calcium-dependent B12 absorption in the small intestine. Over time, this can significantly deplete your B12 levels. Additionally, other factors such as aging, gut damage, autoimmune gastritis, and poor dietary intake, especially in plant-based or highly processed diets, further contribute to B12 deficiency in diabetics. B12 deficiency often develops subtly, but its effects are widespread. It impacts multiple systems in the body. Neurological issues. One of the most common signs of B12 deficiency is nerve damage, which may cause tingling, numbness, or a burning sensation in the hands and feet. Left untreated, B12 deficiency can lead to peripheral neuropathy, a condition that worsens over time. Mood disturbances. B12 is necessary for the production of neurotransmitters that regulate mood. A deficiency can lead to anxiety, depression, brain fog, and even paranoia. Fatigue and weight gain. Since B12 plays a crucial role in energy metabolism, low levels can lead to fatigue, low energy, and unexplained weight gain. Heart health. Vitamin B12 helps to lower homocysteine levels, which, if elevated, can damage the blood vessels, increase the risk of heart disease, and contribute to arterial stiffness. Consequences of B12 deficiency. Without sufficient B12, cells can't divide properly, mitochondrial function is impaired, and energy production slows down. The effects on the nervous system can lead to cognitive decline, and the damage to the heart and blood vessels increases the risk of cardiovascular issues. Natural sources of vitamin B12. To ensure adequate intake of B12, incorporate these foods into your diet. Beef liver, just 3 ounces, 85 grams, provides an astounding 3,000% of your daily B12 requirement. Sardines, 3 ounces, deliver 338% of your daily B12 needs. Atlantic mackerel, 3 ounces, offer 278% of your daily B12 intake. Salmon, 3 ounces, provide about 80%. Eggs, 2 large eggs give you approximately 46%. Gourmet meal ideas. For those who want to enjoy luxury meals rich in vitamin B12, here are some ideas. French foie gras pâté, duck or goose liver. A 100-gram serving delivers over 4,000% of your daily B12. Mediterranean grilled mackerel with lemon and capers. 150 grams offers over 350% of B12. Japanese miso-marinated black cod with a soft-boiled egg. One full dish provides 120–150% of your daily B12. Supplementation. If you need a supplement, the best forms of vitamin B12 are methylcobalamin and hydroxycobalamin. Methylcobalamin is the active form and is preferred for neurological issues. A typical dose of methylcobalamin is 1,000 micrograms daily. Hydroxycobalamin is often given in injections and is typically dosed at 1,000 micrograms every 1 to 2 weeks for those with deeper deficiencies. Both forms bypass the usual absorption issues, especially in people with low stomach acid or malabsorption. As a diabetic, maintaining the right levels of these 4 essential vitamins, B1, B6, B9, and B12, is crucial for your health. These vitamins help regulate your energy, mood, metabolism, and nerve function, while also protecting your heart and kidneys. By incorporating the right foods into your diet and considering supplementation when necessary, you can support your body and manage your diabetes more effectively. If you found this information helpful, I encourage you to like this video, share it with someone who may benefit, and subscribe for more tips on managing diabetes. Stay informed, stay healthy, and I'll see you in the next video.